Hi everyone. Thank you for waiting. Thank you for your patience, and thank you VickinoDay for the invitation. I'm Lilit, and I'm representing EFES Insurance Company, but we are not going. My speech will not be about the competitive advantages of EFES today. I'll be speaking how private health insurance companies may help the state to build a resilient healthcare system. Just a couple of words about EFES itself. The company was founded in 2023. So we are relatively young. However, the founders and key personnel have been in insurance market for almost 30 years. So we know, we think that we are good experts and know how to do the business here. What makes EFES different from other insurance players on the market is being in a one group or ecosystem with Vartanants Medical Center. In other words, if you are a customer of EFES and wants to see a doctor in Vartanants, you may get an appointment through early one, as Georg mentioned earlier, and you do not need to call EFES, get an approval. You may just go directly to Vartanants, and thanks to mutual available systems between the organizations, you will get the treatment according, of course, your health insurance contract. If the contract covers everything, you will be covered. If not, you will pay the differences in Vartanants. So we see in EFES, we see our role in not just covering the medical expenses, but to empower individuals to manage their health and well-being. And this is where from our mission comes. You see here the locations of Vartanants Medical Center, 3 in Yerevan and 1 in Vanadzor. What is the meaning of resilient health system for everyone, I guess? It is, the system should be financially sustainable, which means that even if it is pandemics, even if there are economic crises, workforce shortages, etc., the system should continue operate. And it is obvious that the resilient healthcare system is not built only in medical institutions and hospitals, but in the medical healthcare system in total, and private health insurance companies, private health insurance system plays a vital role here. What is health insurance about traditionally and modern health insurance? Traditionally, as you see, insurance companies are just covering medical costs, or I would say we're just covering medical costs, when a person gets sick and just go to a medical center and pay for the received medical expenses. Now real impact of insurance begins before that. We see the value of the insurance industry in empowering stability in progress. As I mentioned before, the mission of EFES is to empower individuals and society to focus on life's positive and creative pursuits. How traditional health insurance should do that? Modern health insurance should do that. If you are looking at insurance programs of all insurance companies available currently in the market, you will see that preventive medical checks are available in nearly every program. This means that not only individuals but also insurance companies are paying much attention on that. If we are looking on our claim histories and claims portfolio 4 or 5 years ago, we saw that preventive medical checkups are on the last places, while now we see that people are going to preventive medical checkups, and we see that preventive medical checks are on the top 3 among the all medical categories. People are paying much more attention on their well-being and mental health, and this is what recently have been added on mental health, and this is what recently have been added also by insurance programs by insurance companies in their programs. Chronic disease management programs, which are again also available in majority of our health insurance programs. So insurance companies are now considered not just payers but partners, and we are not doing just claims management, but we are doing risk management while giving a risk portfolio of each of our corporate customer if they want to understand what should be targeted, paid attention to. If I'm speaking about the role of private health insurance in the healthcare system in general, just for your information, currently the whole insurance market of Armenia has 150,000, around 150,000 insured plan members under the private insurance plan. And even with the introduction of public health insurance with effect from January 1st, 2026, these people continue using their private insurance plans. And with this, we see reduction of public healthcare pressure thanks to private insurance. What are the challenges currently which we are facing on the market in health insurance? We have a low insurance penetration rate. As you see, insurance makes only 0.7% in the Armenia GDP. However, this figure means that we have also a gap to raise, and we are working there. Limited insurance culture, we are receiving several calls a day when a person says, I'm in the hospital now and I need this or that medical intervention. Can I get an insurance policy before I get that intervention? And we very much hope that the introduction of public health insurance will also assist in increased insurance culture. And we see continuous increase of the medical costs in Armenia. Some are for good reasons, which is new medical technologies, but also there are no cost-sharing plans in Armenia, which is very common for US, for France, and for the whole Europe. In Armenia, this is not common. If there is an insurance in place, I'm speaking about private insurance only, then usually if it covers 100% of the costs, and there is no, for example, 10%, 20% of co-payment payable by the insured person. Usage of AI, this is practiced by our customers very much. When they go to the doctor and get some diagnosis, then they try to find in AI if their diagnosis is correct or not, and if AI gives them other possible diagnoses, they are always request for the second opinion. However, these challenges brings to us also some opportunities in terms of the developing insurance schemes, technological development, and despite of the challenges we are facing, compared to developed market, we have a better customer experience. All insurance companies nearly all, I would say, have very fast claims management system. Again, majority of insurance companies today have their own mobile tools and mobile applications, while making the customer experience and claims management system more faster and easy. And of course, we all know that if a person has private insurance, he or she has easy access to the medical center. That's it from my side. If there are any questions, I'll be glad to answer even now, or I guess we have a break. Okay.